Good evening, everyone. I am so sad that I'm unable to be there with you in person tonight. It took 2 whole years, but COVID finally found its way to me. Thank you to the Hoag team for allowing me to still be part of such a special event. I am honored to be able to speak to such an influential group of individuals and to have the privilege of thanking each and every one of you for the impact that you've had on my life and of that of my family. My name is Kaitlin Jones. I'm a 31-year-old resident of Long Beach. I am a physician assistant in hematology oncology. I am a fiance, dog mom, daughter, sister, aunt, granddaughter, niece, cousin, and friend. And I am a VEDS patient, and as the slide indicated, a grateful VEDS patient. Although VEDS does not define me, it does keep a firm grasp over my life. Vascular Ehlers-Danlos syndrome, or VEDS, is a genetic condition that causes production of faulty collagen that leads to weak connective tissue. Lucky for me, connective tissue is everywhere in the body, from your skin and muscles to your blood vessels and organs. VEDS patients are at risk for life-threatening emergencies, including spontaneous aortic dissections, arterial ruptures and aneurysms, as well as organ ruptures like your bowel or your uterus. Surgeons have often described surgery on a VEDS patient as if they were trying to sew together pieces of wet tissue paper. For these reasons, the median life expectancy is about 51. Because of our inherent fragility, I am not supposed to overexert myself or put too much strain on my body. I have been advised to avoid pregnancy, strenuous exercise, heavy lifting, as well as adrenaline rushes. I guess public speaking is okay though, Dr. Liang, right? But before I ever heard about VEDS, I lived a pretty normal suburban childhood in Irvine, California. I was born on July 10th, 1990 at Hoag Hospital. My brother Trevor was born a few years before me, also at Hoag. Our family of 4 was very tight-knit, and we spent a lot of time with my mom's side of the family, who also resided in Orange County. In 1996, my mother, then 40, developed a severe abdominal pain in the middle of the night. She was evaluated at Hoag, where her symptoms were dismissed, and initially she was just sent home. Her condition worsened, and she took herself back to the hospital. She was found to have a ruptured artery in her abdomen that caused damage to her bowel, and she had a very bad coexisting infection. Part of her bowel had to be removed. She nearly died and spent weeks in the hospital, as well as many months recovering at home. No one could tell us why this had happened. In 2004, my brother, then 17, developed a severe chest pain in the middle of the night. A 17-year-old with chest pain? Surely a walk-in clinic could take care of that. They diagnosed him with a collapsed lung, and he was sent to UCI Medical Center. But there, further testing revealed the truth. A healthy, athletic 17-year-old had suffered a descending aortic dissection that nearly killed him. And again, no one could tell us why this had happened. Trevor was flown to the Mayo Clinic in Minnesota. His sample was then sent to a special lab in Seattle, Washington for genetic testing. Finally, after chasing a diagnosis between multiple corners of the country, VEDS was discovered. Over the next few years, Trevor's dissection grew into a dangerous aneurysm, and he required 2 open surgeries to replace the majority of his aorta. There was not a local specialist available, so we had to fly to Houston, Texas both times. Because VEDS is genetic, we were able to trace the disease up our family line to my maternal grandmother, Libby. The statistical risk of passing on the gene is 50-50, but somehow Libby struck gold when she passed it on to 100% of her 3 children. My Aunt Denise passed it on to one of her 2 kids, and my Aunt Dory to one of her 2 kids. My mother had immense guilt about passing on this genetic condition to my brother, so I hesitated to get tested. But my mom began fighting another entirely different battle, or rather a war, with breast cancer, the disease that ultimately claimed her life. My mom took her final breaths surrounded by her family at Hoag Hospital on October 31st, 2012. Today would have been her 67th birthday. Happy birthday, Mom. After her passing, I was formally diagnosed with VEDS. A screening CT detected a dissection in my internal carotid artery. In retrospect, I realized that I had had a TIA, or transient ischemic attack, at the age of 21. At the time, I had assumed that the sudden weakness in half my body and the numbness in my face was just a side effect of spring break in Mexico. Hindsight is 2020, I guess. Between 2014 and 2018, I worked hard to find a medical team that I could rely on. I was seen by some of the best doctors at UCLA, Cedars-Sinai, and Hoag. None of them wanted to operate on me, and no one could reassure me about how much I needed to be monitored and how I should live my life. One of them suggested that I fly to Texas should I ever need surgery. I thought I finally hit the jackpot when I met a VEDS knowledgeable physician at Johns Hopkins, but he kindly reminded me that I live in Southern California, and flying to Texas or to Baltimore in the event of emergency was certainly not feasible. I felt defeated and angry, and I broke down and cried. After graduate school, I settled into Long Beach and decided to give up my search for a while. Around that time, my cousin Lauren was starting her family, and she was on an exhaustive search of her own. With the fate of good timing, she came across Hoag's brand new clinic for Marfan syndrome and related conditions. Pregnancy can be extremely dangerous for a VEDS patient, but with Dr. Liang's help, Lauren was able to put together a team that helped guide her through her pregnancy safely and safely deliver her daughter, Avery. Avery inherited VEDS as well, so now, at 20 months old, she is Dr. Liang's youngest patient. Lauren raved about this new team, so I was excited to see what they were all about. At my first appointment, I met Meg, the clinical nurse navigator who has VEDS herself. Now, it cannot be understated how terrifying and lonely it is to have a rare disease that most people have never heard of. Meeting Meg was the first time I had ever met anyone outside of my family with VEDS. It was the first time I felt that we weren't so alone in this. The first time that I was able to discuss with someone my fears and anxieties about so much uncertainty, existential questions about life and death. Should I save for retirement or live for today? Although I am her patient, Meg treats me like a friend, and I am forever grateful. Dr. Liang put together both an emergency plan and a surveillance plan for me, and he gave me his cell phone number, insisting that I call him if anything happens. Aside from colleagues, I've definitely never been given a physician's cell phone number before. As a physician assistant myself, working in hematology oncology, I understand what it takes to comfort a patient or a caregiver in their darkest times. I know the sacrifices you have to make to provide good patient care and the toll that it can take on your personal health. Dr. Liang's team surpassed all of my expectations. I broke down and cried again, but this time out of joy and not defeat. I had finally found my home. Slowly but surely, nearly my whole family found their way to Dr. Liang's new clinic. Life felt hopeful. My career was blossoming. I loved where I lived. I found the love of my life. Dr. Liang had found some new minor arterial dissections, but they were stable, and he reassured me not to be worried. And I became an auntie. My brother chose not to pass down the VEDS gene, so he went through IVF. So healthy, beautiful, angel baby Finley Kagan Jones was born on March 26th, 2021. I wish the story stopped there and that we all lived happily ever after, but it doesn't. In October 2021, my brother, then 34, had his second major VEDS event while in Alabama. This time, an artery ruptured in his lungs. At the hospital, the doctors had to Google what VEDS is, while I was texting Dr. Liang and he was on a plane. He was trying to give me instructions of what they should do to save his life. Trevor didn't survive. His baby girl was 6 months old. A lot of questions have plagued me since that day. What if the emergency room providers were more educated about VEDS? What if Trevor had been closer to Hoag? Would that have made a difference? Unfortunately, my story is not unique. There are thousands of other families across the country and the world, just like mine, who have lost their loved ones far too soon to complications from VEDS and other related conditions. What is clear to me is that there is more work to be done, more education, advocacy, and awareness, more research. Because of your donations, Hoag is now at the forefront of all of this, hosting philanthropic events and national conferences, and being a clinical site for groundbreaking new research. I now have the opportunity to potentially receive a life-saving drug here at Hoag with a clinical trial. What was once an impossibility is now a reality. Amidst my grief and amidst my fears, I remain hopeful. Thank you to Dr. Liang, Meg, and the entire team at the Clinic for Marfan Syndrome and Related Conditions. Thank you to the Hoag Innovators for providing the foundation for a brighter, healthier, and hopefully longer future for me, my family, and other families like mine. Thank you.